Mayo is the best known and most trusted brand name in medicine.
For over 100 years, Mayo Clinic has been a patient-centered, integrated practice of medicine that also has a research arm and an education arm. But the unique thing about Mayo Clinic, and I believe the reason it's been successful and has filled a void perhaps in the medical field, is its patient-centeredness. The patient's at the center of every decision we make and everything we do. We always try to say, where's the patient in this decision? And so we've integrated our entire healthcare delivery system and knowledge creation system around the patient. We've done that forever.
Principally, the key innovation at Mayo Clinic goes back to our earliest days, and that's the integrated group practice of medicine. So you have here a collection of physicians, scientists, allied health professionals who unite all their different skills around one mission, serving patients, and that's supported by education and research. Unlike a typical university academic setting, research and education here support the patient care mission. That really is our major contribution.
We have one goal or focus, and it's just the needs of the patient, and we reference that 1,000 times a day. It's very real, like it's not gratuitous, it's not just PR, it's absolutely part of how every decision gets made. It's based on the needs of the patient.
Our philosophy is to treat the whole patient in the totality of his or her life, and we know that, of course, would be the disease that you present with. That's the immediate area of treatment. But we know that patients have spiritual, social, emotional needs, and we want the medical environment here to respect all of those things. So when you come here, Caesar Pelli, the designer of the Gonda building, said, healing begins when you walk in the door. Before you ever see your doctor, you're in an environment where there's music, where there's art, landscaping, that'll put you at your ease. Your tests are ordered in an efficient, smooth way so you're not stressed by waiting. There are things to occupy your time, like cultural programs, music, different things to do. There's a spirit here, very customer service minded in our philosophy. Quite typical, you'll see Mayo employees in the hall stopping. Can I help you with directions? Are you lost? Do you need something? And people really take pride in doing that. They'll often say, the best part of my day is I was going to a meeting, but I saw somebody who was clearly upset in the hallway, and I could talk with them and offer them directions or give them a shoulder at that point. And that service mentality, combined with design, with efficiency, with excellent medicine, is what brings our patients back over and over again.
Everything at Mayo is led by a physician. You have to have a physician lead in everything, and it's a really, really interesting. I think it's a fantastic model again, because I think it doesn't separate. It makes everything very grounded in medicine. So I often joke about if we had a knitting circle, we'd have to find a doctor who liked to knit.
The Mayo brothers always spoke in terms of my brother and I. They were the first team here. They worked very closely with the Franciscan Sisters, a Catholic order who founded our first hospital. There's always been this sense of you want to surround yourself with really good people who have different points of view, different skills. And so it's been very natural here to bring all professions, nursing, administration, allied health, design, communications, etc., together to form teams. And we always have a bullseye with that team, the patient. So you have a reason for coming together. You can find what you have in common, put aside what you have as differences, and rally around that cause. So it's a cultural attribute more than anything else. You walk into a meeting with a mindset that we all have different things to offer, but we want to work together for this goal of serving patients. And that has really brought a shared decision-making culture here. We have rotational leadership where people will rise to positions of authority, but then they'll step back into the ranks. So there are no fiefdoms here. There are no kind of balkanized departments. We work together in kind of a holistic fashion.
So if you have a physician always with you working on whatever you're working on, they're ultimately going to be the voice of the greater community.
Nothing has changed since the days of the Mayo brothers. They could come back and sit with us today, and they would feel perfectly at home in our environment. Medicine, of course, has changed tremendously. Technology is different, but the core value of serving patients has remained the same since their time. We've simply added on to that model.